So I want to be very clear here. I don't believe that the fuzziness in the definition of the difference between drug and food denotes any type of lack of sophistication on the part of the Hippocratic physician. These physicians did have a category for food and a category for drug, and we've seen it in this passage, and we can see it in all sorts of formulae that they use, and this is just one example. So they say, in this case, so this is a black disease, so a disease that involves black bile probably. It is necessary to purge with medicaments, that purge from below and from above, and after that to drink ass's milk and use foods that are as emollient and cold as possible. So this formula is very common in the Hippocratic treatises, and you just replace emollient and cold with astringent and hot, and you have whatever effect you need. So in this formula, the word food refers to, I suppose, normal items of diet, and the word pharmacon refers to purgative drugs. So drugs are laxative, diuretic, or emetic. And I'm certain that the Hippocratics must have considered some substances, such as hellebore, for instance, which is a strong purgative, as a pharmacon, as a drug. And just as an aside, I use drug both in its positive and negative meaning here. I'm not entering that discussion. And they must have considered other substances, such as lentils and chickpeas, as foods. But there were cases in which that distinction was more difficult to draw, and there were also cases where the most innocuous looking food could be used as a drug. And here I would like to talk about garlic, which is a good example to discuss both in the ancient and in the modern context. And again, here I want to say that what I'm looking at is uses of the plants that the Greek called skorodon, and we usually translate this as garlic, and I think this is a correct translation, but sometimes it might be used to talk about another plant, and conversely, other words might have been used in Greek to talk about garlic. It's all rather complicated. Today, garlic is primarily, as you know, an item of diet used to flavor dishes. However, you will probably all have come across this type of garlic supplement, which I claim to have a positive effect on the cardiovascular system. So they are believed to lower cholesterol. And from what I've read, it's not that well established from a scientific point of view. The experiments are not conclusive. There have also been some lab experiments that have shown some antibacterial, antiviral, and antifungal properties in garlic, and as far as I understand, this was done on rats, but when it's tried on humans, it's not as conclusive. So research is ongoing. You know, you can, if you Google, you can find articles in serious journals that are very recent, 2008, 2009, about garlic, and so And this is a clear example of what we think as a food that is used in health context. And we've seen other examples this morning. And in the same way, in the ancient world, garlic was primarily an item of diet. And it was much derided by comic authors because of its well-known impact on the breath. And it was consumed in large quantities, and because it was probably eaten not only to flavor foods, but really like onions, you know, you bite into it. And it was consumed in such quantities that during the Hellenistic period, so that's the period after the death of Alexander the Great in 323 BC, there were attempts at specialized cultivation of garlic in Egypt. In addition to being an item in everyday's diet, garlic was often recommended by medical authors as a food to be used by patients following a treatment. And here I have an example, and this is the case of a woman. It comes from one of the gynecological treatises of the Hippocratic corpus, and it's a woman who's suffering from a displacement of the womb, so a womb has moved, and her treatment consists in purgatives, fumigations, fomentations, manipulations of the womb, and other applications. And then we have this, and let her eat a lot of garlic, both raw and boiled, and drink its juice as a soup, and let her make use of emollient foods. And at times, garlic also enters the list of items of food that patients should avoid. It's not always clear why that is the case, but most of the time it's because garlic is a windy plant, so it causes flatulence. In the second book of the Hippocratic Treatise Regimen, so this is another Hippocratic text, it's a very important one, which is in 4 books, and the 4 books are all very different, and this comes from the second book, which is a catalogue of food, and it's absolutely fascinating, and this is what the author of this catalogue has to say about garlic. Garlic is warm, excretive and diuretic. It is excretive and diuretic because of its purgative quality. It is good for the body, though bad for the eyes. For by making a considerable purgation of the body, it dulls the sight. When boiled, it is weaker than when raw. It creates flatulence because it stops the pneuma. This final sentence is a bit complicated, and the pneuma is basically some sort of vital fluid that circulates in the body, and it can be blocked. It seems that not all these claims were accepted by all Hippocratic physicians. In particular, the claims relating to the eyes seem to have been disputed. So the author of Organ of Sight, and here I'm following for those who know about this, I'm following the emendation of, so the text is difficult to establish, but I'm following the emendation of a scholar called Elizabeth Craig. So if we follow emendation, in Organ of Sight we have a recommendation to eat raw garlic in the treatment of night blindness. So that author would think that garlic is actually very good for the eyes. And the author of Epidemics 2, which is another of those Hippocratic treatises, prescribes eating garlic and barley cake after the application of an eye remedy. In later medical works, one finds remedies containing garlic to be applied directly to the eyelids. And that's probably because when you put garlic to your eyes, you know what happens, you start crying, and so it purges the eye, I guess. And one won't find that type of remedy in the Hippocratic corpus, but interestingly, contemporary of the Hippocratic writers, who is Aristophanes, who is a comic writer, creates this comic remedy to be applied inside the eyelids. First of all, for Neoclides, and Neoclides is a corrupt politician, Asclepius is the god of medicine, set himself to knead a plaster, throwing in 3 cloves of Tenian garlic. Tenos is an island of the Cyclad island. Then he crushed them in the mortar, mixing them together with verjuice and mastic. Then he soaked the mixture with Sphetian vinegar, and vinegar Sphetos is a little part of Attica, so the region in which Athens is set. And turning out the eyelids of the man, he plastered them to make him suffer more. This is one of my favorite texts ever. And in all the commentaries to this text, people think this is a complete joke. But actually, if you look in medical texts, all those horrible ingredients, garlic and mastic and verjuice, are used in eye remedies, because eye remedies were supposed to be horrible. They were supposed to purge your eye. The only thing that is not realistic here is that it's put inside the eyelid. That would never have happened. By starting to discuss the use of garlic in the treatment of eye diseases, I've slipped into a discussion of garlic as a drug rather than as a food.